So let's move on to talking about trajectories. This came up at the last meeting as a topic that you wanted to hear about, particularly with respect to regression. We've got 3 speakers, and I'll just introduce them as they come up. Dr. Amy Thurm is a staff scientist in the NIMH Pediatrics and Developmental Neuroscience branch. She's a licensed child clinical psychologist who specializes in ASD and other neurodevelopmental disorders, trained at DePaul University and Boston Children's, and did a postdoc at Hopkins. She's been at NIMH since 2002, first in the extramural program, but since 2006 in our intramural program, working with Sue Sweeto and others in the autism program there. Welcome.
Thanks to you for inviting us, and thanks to my other panel members, and I'm happy to be here. I also wanted to add to my introduction that I'm also an aunt of a child with autism who I went through the process with of the unfolding and diagnosis. I'd been in the field for a long time. So thinking about regression and trajectories of onset of autism has been something that many of us have been focused on for a long time. And even though this is a very nitty-gritty title and talk about how we really can define and measure and try to classify regression, actually a better title came from one of the IACC members, which is coming closer to describing the variable onset pattern in autism, and that was a paper by Jerry Dawson, just to acknowledge that a lot of people in this room and researchers around have really spent a lot of time trying to unravel this in many different ways. We've already talked today about really the importance of onset trajectories and thinking about this idea of, quote, regression, and we'll unpack that quote as we go, as really essential for learning about the etiology and interventions and when and how you can intervene. So I'll just get to my take-home messages before I even start, which is that this term regression is loaded and has a lot of terminology related to it, and we need to sort of think more about the term we're using and then how we measure it to drill down. So regression, as has been pointed out today, a lot of the things said have been pointed out today, which is great, so I'll try to go fast, was used from the very beginning from Leo Kanner. If you go back to the 11 cases, in the 3rd case that he described, it was a child named Richard, whose mother described, "I can't be sure when he stopped the imitation of word sounds. It seems that he has gone backward mentally gradually for the last 2 years." She says that when he was just approaching the age of 3, so it sounds like right around 12 months, something changed for him. And this description, I think, is very helpful because, first of all, it talks about language as being the first thing described as a loss, although if you listen carefully, she talks actually just about the imitation of words, which is already talking about the compounding of the language, word development, and the social, because really imitation is the social piece of it. And then she also talks about it being gradual and this sort of insidious where it's really hard to pinpoint the exact time and place for some of these kids. On the other hand, regression is also a term used very, very widely in psychiatry and neurology for a lot of things. And I just point out a few examples here that it has been used to discuss the significant decline in a previous diagnosis, childhood disintegrative disorder, certainly in mitochondrial disorder where kids can be 10, 11, 12 years old and all of a sudden have very significant sharp onset of major loss of motor skills and other things, specific epilepsy syndromes and other neurologic problems in general. I'm just pointing out related from our DSM-4 category was Rett syndrome, in which regression is one of the key features, and where we should kind of stay tuned to Rett syndrome as learning more about regression, since animal models have been starting to try to crack at this, and now that we are getting genetic diagnoses of Rett syndrome, very early on. I just saw a study that came out looking at early onset of delays in children with Rett syndrome even before this regression occurs for those children. So I'll start with sort of where we were. What we were doing for a long time was we were doing studies where we categorized groups of children as either having regression or not having regression, sometimes based on totally unstructured interviews, and then more recently based a lot on the diagnostic interview that was done, which most often has been the autism diagnostic interview. These studies, I'm not going to get into them too much, but because they're extremely variable in how they define regression. For a long time, it was only language regression. It was really only word loss and more like phrases that were used. And then more recently, several studies have started to bring in at least some social loss, although some of that has been very specific. And as you can see, there were very variable results when this is only looking at behavioral outcomes. There's a much longer literature that has looked at other types of outcomes, including medical, just in terms of very either cognitive or ASD symptoms. As you can see, there are definitely reports of worse symptoms in children with that categorically defined regression versus not, and as well as studies that showed autism symptoms being worse but not necessarily cognitive skills, and then several that did show no differences. I didn't put on here, but there was one study that did show actually higher skills in children with regression. So it's just been all over the map, which has really led us to say, what are we doing here? Are we defining this in an appropriate way? So generally, those studies found about 25 to 30% of children having regression pretty consistently across the board, although it started to change when social loss got included in the definitions. At the same time, we have very luckily been able to start conducting the baby SIBS and other at-risk studies that have allowed us to look prospectively at infants, and you're going to hear a lot more about that this afternoon. I'm just mentioning it in the sense that it has helped us in learning about a trajectory where we're certainly seeing that early delays are apparent, and more we're seeing maybe not diagnostic, but things that are occurring at 12 and 6 months that we can start to identify, and that there are trajectories that we really want to look at, and these trajectories that have included delays as well as worsening. And social communication skills have really been the focus of these studies. So they've led us to now think about this sort of decline in a more general way. And that raises many questions, but some of them are really, if there is this regression, what is the pre-loss development like in children? How frequently, is this development normal? And what is the timing of this kind of loss, and how does it fit in with a general onset of autism? So several studies in the early 2000s started to look at this. Again, we didn't have a lot of the data we have now prospectively. So Jerry Dawson and others painstakingly went through videotapes after children were categorized as regressive or not, and did start to see that even though they had been categorized as regressive from interviews, that they could see some delays early on. And so these studies just talk in different ways about how delays were seen. The last story I want to mention, because it was the first that I could find that actually included the idea of pre-loss skills in their definition of regression. A lot of the other interviews that had been done really just talked about, did your child lose these skills? Of course, you had to have a skill to lose, but it didn't get into the details so much of when did your child develop skills, how sort of constant these skills were, what they were, and what was developed. Again, a lot of the questions were more, did your child lose language? Did they lose social skills? Really hard for parents sometimes to think about the specifics there without hearing them. So Sally Osinoff and others took a first stab in saying, okay, maybe it's not just regression versus not. Maybe we need to divide it up a little bit better. And you don't need to pay attention to the details here because some of them are ADI numbers, but what these studies did was look at trying to break it into at least 4 groups, so that there would be a group where there was no regression, there was very early symptoms, although this was defined as parents being asked, in hindsight, were there symptoms before the age of 12 months? So it's pretty crude. But again, that upper quadrant being children who really had no regression, they were really delayed from the beginning or had symptoms of autism. The lower quadrant being kids who no symptoms were seen even on hindsight before 12 months, and a regression either in language or in social was reported. And then a middle two groups where one, there was delays, but there was also loss, and another group that was plateau. Again, we're still working on retrospective parent report here, but we're trying to divide it a little bit more. So a few studies were done using these methods, and these were some of the studies that also didn't find differences so much in outcome. And we know, even from asking these questions, that we really want to dig deeper into what the skills were, because parents do have a hard time with these. So what we tried to do in a study where we were specifically looking and trying to be able to categorize children with regression versus not was just to do the best we can with retrospective parent report. We're not going to start from scratch with infants, and we've heard the difficulties in doing that. So we really wanted to just dive in as much as we could using retrospective parent report by really digging into what the skills were. This has been done in a few other studies too. So we did an additional very long interview in addition to the diagnostic interview that asked very specifically about 20 skills, but we really focused on 15 skills. Did your child develop this skill? At what age did they develop it? How consistent was it? If it was words, was it meaningful, spontaneous? Were they doing it in multiple settings? How long was that skill there? And then was that lost? We thought this was the best way without going through videotapes or, again, doing it prospectively, that we could try to look at breaking up this loss into very specific ways. We gathered data on 244 children. Again, about 175 are considered ASD. We did have 46 children that had developmental delays that were not autism, and we had 31 typically developing children in the study. And we used this interview that I'm talking about, which we term the regression validation interview. And from this first, I just want to show the differences in, this is just attainment now, whether children had attained these skills at all. They were from the ages of about 18 months to about 6 years old when we did these interviews. So we try to do it as young as possible. And as you can see, luckily, typically developing group, we see it. The developmental delay group, not everybody developed a lot of these skills, but in the autism group, just pointing out, very, as you would expect, because these are children with autism, that a lot of children did not develop a lot of these skills. So just showing you the lowest percentages here. Again, what we would expect to see, very low percent for very specific, what we now think of as great screening questions, early markers of autism. So only 33% reported ever showing objects, and only 24% reported ever pointing to express skills. So when we went through these, and then we're only asking about loss when the skill was actually established, we did find that loss of at least one of these skills, again, they had to have had it to lose it, was reported in at least in 63% of the children with autism. So loss was occurring in most children with autism. And so pointing to express interest, even though it only was gained in 24% of the children, was also the highest reported loss of a skill. Waving, eye contact. So again, these were reported more than language, words as lost, but words were in there as well. And I think that's something just that we've learned more and more, is that a lot of the loss is not necessarily language, but more of these more subtle social communication skills. And that the other thing we really did not expect, and it made the interview much longer, was that the skill occurred at different ages for different skills. Parents would report the loss of pointing was at 15 months, but the eye contact retained until 18 months. It was variable, all within this age range, but it was quite variable. So this is the data when we just kind of look at it by skills attained over time versus skills that remained. So if you're on the line, you kept all the skills that you had gained. And this just shows you what we did not want to see. We wanted to see cut points where we could easily say these children would fit into a regressive group and these children would not be in a regressive group. And focusing on the autism group, although you do see you see loss in PDD and you do see a little bit of loss in the developmental delay group, but what we didn't see was this cut point that we were looking for. We were also surprised because, again, our materials we were recruiting for regression in the beginning, and we did not see many children who had gained all of the skills and lost them all. We saw one child where that was the case. I mean, there were children who had gained a lot who had lost, just a few of them versus quite a few of them, but we just didn't see the cut point. What we really saw over and over again was that this was a continuous measure of how many skills were gained and a continuous measure of how many skills were lost. And they were independent of each other, and they were much more dimensional than categorical. So, and this just shows over time the skills that were gained, and then skills lost. And you can see, and you'll see trajectory data later this afternoon as well, showing that, I mean, overall there is a dip, as you would. It's not just skills not being gained anymore in children with autism. There is definitely a dip overall, and if you start to categorize those who lost more, you can see a much more downward spiral, and that typically developing children from just a few months of age bifurcate here, but children with autism start bifurcating at 14 months from the developmental delay group, and for the children with PDD, it's not till 18 months. So when we're hearing and we're doing these interviews, we're hearing my child started flapping around the same time very commonly. And we're realizing that, yes, regression is not about starting skills, it's about losing skills, but we really need to make sure that we keep the beginning of other autism symptoms into the picture here when we're looking at loss, and really thinking about trajectory of onset of autism symptoms versus this idea of just regression. So using the ADI in a version that allowed us to ask about the onset of repetitive behaviors, we looked at the timing of the first loss that occurred for a child, again, when the loss was variable over time, and we found that in 61% of the children, the repetitive behaviors that they reported actually preceded were earlier than the loss of skills. So the idea that regression is something that happens first and then autism happens after is muddier than we thought. Going the wrong way. So it's just trying to picture this. I think it's really 3 or 4 dimensional rather than a one-dimensional idea of this regression being categorical. That, I mean, this is how I'm thinking of it now, that we certainly have the timing where things happen at different times. We have early delays occurring, we have loss occurring, and then we have the development of interfering behaviors that all come together. So now I'm going to talk about, now that I just presented only retrospective parent report, I'm going to talk about some of the limitations of this that we've been lucky enough to be able to learn about now that we also have prospective studies. So I think we're going to hear more about this later as well, that when you ask parents, even when they're 2 and this happened at 15 months, they have a hard time remembering, as we all do, have a hard time remembering what we did yesterday. We start to hear, I'm really not sure about the ages, I'm really not sure, did he do this skill every day, or was it just a couple times? I remember this one time, so I think he did it all the time, things like that. Because then when we ask later, we often get different stories. So there were some studies that actually did ask at 2 time points and found up to 20% disagreement at those time points. So again, now that we have prospective studies, we can start to look at the differences. And I was lucky enough to get data that is hot off the press from Sally Osanoff at the Mine Institute, and we've been working together on this in a lot of ways, but she has the prospective data where she's at 7 different time points from 6 to 36 months, been doing studies where she's using observation during testing to rate behaviors, social communication behaviors, such as sharing enjoyment, smiling, eye contact. And from these, she has done latent class and found 2 groups. Again, the white line on the top is typically developing children, so they're having these skills and getting better and keeping them. But within the children who end up with autism at 36 months, she has 2 different classes, and most commonly was a class which was 89% of the children that by observation of examiners looking over time, they were declining in these skills, in these social communication skills that she was looking at. She had previously done a study where at 36 months she had done the autism diagnostic interview and asked the question about regression, and most of the children who she found in this group who had undergone this decline, parents were not reporting a regression at all. So what she did in this cohort was she was able to ask the parents at each of these time points how they felt about these specific skills. And when she did that, she had much greater agreement. So 71% compared to 89% now of the parents did report, actually, compared to how he was at 6 months. Now at 12 months, he's showing less of these skills. So there was much greater agreement. She also noted that there were some parents who continued to report that their children had lots of skills, and those children were also in this, had autism at 36 months. So with 30 seconds left, the concluding remarks are just that we really want to think about loss. There's no question that we're going to hear a lot more about the more we see in younger children starting. We're seeing this downward loss of skills, but the idea is whether we can think about it at all categorically or whether we have to think about it dimensionally. And I will conclude there.